Okay, it's right about 9:30, so it's time to start. We're going to try and follow the meeting agenda to the T today, if we can. So the first thing we're going to do is the employees for years of service. Do you want, you know more than I about this.
Sure.
About this.
Yeah, so with our meat and poultry division, we have 10 years of service. So unfortunately, we don't have pictures for these folks today. But Nicholas Klebinger is 10 years of service. Then we have Nathan Campbell with our dairy division with 15 years of service. He is our deputy division director there. Gary Cron with 20 years of service with our dairy division. He's one of those, he's one of our dairy inspectors that we've been able to actually bring back part-time. So he retired from the agency and we brought him back part-time to serve as that dairy inspector up in northeastern Indiana. And then Patricia Price with 40 years of service. Trish is with us today. So Trish is in our dairy division. She does all the things in the dairy division, so I don't want to limit to what she does because she keeps it running. So Trish, we appreciate your years of service.
Thank you.
That wasn't nice.
You started in high school, it's okay.
Yes, that's all right. That's what I mean.
There we go.
Thank
For those
you.
of you around,
Thank
he's
you.
been, that's longer than I've been alive.
I appreciate it. Thank you.
Well, we have one more, and I'm going to do this one. It's for Kyle Shipman
Oh.
for 10 years of service. They know you well enough, I don't have to talk about it. Congratulations.
Appreciate it.
Now we'll officially call the meeting to order. We're going to have to do a roll call, of course, because we do things online. Go ahead, Gary.
Okay, Dr. Armstrong,
Aye.
Keith Beard,
Aye.
Craig Bowers, he's going to be absent today, Virgil Bremer,
Present.
Dr. Gillespie,
Present.
Dr. Hall,
Present.
Dave Harden, present, Ty Harberger,
Present.
Dr. Ragland,
Here.
and Tim Rice, here, and Dr. Doig.
I'm here. So you all have in your enlarged pack that we got, very thick this time and lots of pages, but hopefully we can get through it pretty quickly. The minutes from the last meeting, and you should have all been able to read those. And I need a motion to accept, reject, change, whatever.
Motion to approve is written. Second.
It's been moved and seconded. Gary?
Dr. Armstrong,
Aye.
Keith Beard,
Aye.
Virgil Bremer,
Aye.
Dr. Gillespie,
Aye.
Dr. Hall,
Aye.
Dave Harden,
Aye.
Ty Harberger, Dr. Ragland,
Aye.
Tim Rice,
Aye.
and Dr. Doig.
Aye. Motion approved. So we're going to go through some proposed rules. First one is a public hearing on the dairy products proposed rule. Sarah?
Yes, good morning. There are two documents in your materials for this public hearing for LSA document number 25151. Denise, should I be down here? Do you want me over here?
If you're
Yeah.
over here, we can see you. on
Okay,
camera.
I
Or
was
no,
like, oh, wait, that's not right. Okay. So this is our dairy products inspection rule. And so the components of it is first to update the incorporation by reference for our rule for the manufacturing grade milk product regulations. We're updating from the 2019 version of the PMO to the 2023 revision. And then also updating certain food safety standards for going from April 1, 2020 to incorporating those food standards to April 1 of 2024. So as far as the changes from the 2019 PMO to the 2023 revision, in the regulatory analysis, which is on page 3 of the document, it talks some about what the major changes have been in the PMO from those two versions. The first piece of that is there's a phasing out of a lot of the memorandums of information and incorporating those within the federal regulations. So this really doesn't change any compliance costs for our grade A farms because they're already operating in compliance with the MIs. The second major change in the PMO is the methods of making sanitation ratings. They're eliminating the automatic deduction of 5 points when an inspection takes place outside of milking times and reassigning those points to other inspection categories. So that was another major change. And then the final change is modification regulatory actions if an FDA audit results in a finding of noncompliance with Appendix T of the PMO. So the prior version basically automatically required a reinspection within 60 days and immediate removal from the interstate milk shippers list if the BOA reinspection also results in a finding of noncompliance. Now, the new version of the PMO allows a written corrective action plan and implemented that's acceptable to BOA versus an immediate plant delisting. So those are the three main changes and in the PMO. So just to backtrack 1 second, I know I failed to update all of you. I know this is only our second public hearing under the new rulemaking process. Our first was our fees, fines, and civil penalties rule. And so as we are at public hearing today, the new process is very similar to what we did previously, but there's a few changes as far as the OMB approval remains the same, where you submit the rule before it comes to this board. And then if there's any changes to fees, fines, or civil penalties, they would also not only have to first obtain OMB approval, but then also go to the budget committee. But because none of the rules today made any changes to our fees, fines, or civil penalties, we did not have to do that for this, but we did for the fees, fines, and civil penalties rule, obviously, that we previously had before the board. And so at that point, once you get those approvals, then there's a notice of first comment period, and you'll see there on the first page of the final rule, for this rule, we had a 30-day comment period from March 26th to April 25th. We did not receive any public comments on the dairy products rule, so I don't have any of those to provide to you today. And at that point in time, then we are here where we are today with our public hearing. There is a provision in the new statute that if the agency receives substantive comments or concerns, that then there is a requirement for a second public comment period, but we did not receive any of those, so we would not need to do that except unless we receive any today. And then at that point in time, it is submitted to the Attorney General for legal review and then on to the governor, which that process, part of the process has not changed. So that is just a little bit about the new process and just letting you all know we did not receive any public comments on this rule. So with that, I'm happy to answer any questions. I believe that takes us all the way through the rule changes. And so with this, I'm happy to answer any questions.
Okay, if we have no questions, we have to open this now for public speaking. Anyone care to speak here or online? If not, we'll close the public hearing on that, and we need to consider the adoption, so I need some motion, please.
I so move. To adopt.
Need a second?
Second that.
Been moved and seconded. Gary?
Dr. Armstrong.
Aye.
Keith Beard.
Aye.
Virgil Bremer.
Aye.
Dr. Gillespie.
Aye.
Dr. Hall.
Aye.
Dave Harden.
Aye.
Ty Harberger.
Aye.
Dr. Ragland.
Aye.
Jim Rice.
Aye.
Dr. Dwight.
Aye. Okay, so now we're going to go to the meat and poultry products proposed rule?
Yes, so there are 3 documents for this rule. The first being the final rule, that's LSA document number 25-165. And so the final rule is in your materials, the regulatory analysis. That is another change. There used to be 2 documents. There was a fiscal analysis and an economic impact analysis. Now it's just 1 document, which is the regulatory analysis. And then we also did receive 1 letter of support from the Indiana Meat Packers and Processors Association. So that should be in your materials as well. So similar to the dairy products rule, this is something that we routinely do every 2 years, where we update the incorporation by reference of the federal meat and poultry inspection regulations we're updating it to January 1, 2024. And then we also incorporate subsequent amendments that occurred since then with regard to the voluntary labeling of meat products with U.S. origin claims. It also adds a new section to the meat and poultry rules that clarify the requirements for establishments to manufacture pet food in areas where edible products are produced. So as you are looking at the regulatory analysis, I'm going to speak from page 3, which talks about some of the changes in the proposed rule. So the first is I want to bring to your attention some of the changes in the federal regulations from the prior incorporation by reference to the 2024 version. A lot of these are, I believe, to be beneficial for these plants that are engaged in these activities. One is it rescinds dual labeling requirements for certain packages of meat and poultry. It rescinds a regulation that requires condemnation of poultry carcasses affected with any forms of avian leukosis. And then the third one, which got more, is really got more attention, and is the replacement of the FSIS product of USA policy with these new requirements for how, if you want to use product of USA on your packaging. They really found that to be misleading to consumers. So under the new regulations, the claims product of USA or made in the USA may be used if the products are derived from animals born, raised, slaughtered, and processed in the United States. And then if you want to use claims other than product of USA or made in the USA for components, it has requirements for if you want to include a description of the preparation and processing steps that occurred in the USA. So basically like a qualified label for certain components. And then there's also regulations on state or locality origin claims. So all of that now will be in our state requirements. So if there are any plants that wish to do that, it will align all of that with consumers' understanding of the claim and provide premium marketing opportunities for our plants. So as far as that is concerned, that all will be incorporated. And then as far as the manufacture of pet food in edible product areas, we have 3 to 5 official establishments that are currently using BOA inspected products to make pet food. This change will be beneficial to them because they will no longer have to be using fully inspected product. And so this will allow also approximately 10 custom exempt establishments that have expressed interest in making pet food to pursue this business opportunity. And it also has provisions in there for if they want to then sell that product and it's going to be manufactured in pet food elsewhere. So I think that covers all of the changes. I'm happy to answer any questions. Just wanted to touch on the major changes that will be occurring with this final rule.
Okay, Sarah, if there are no questions, we'll open it for public hearing. Anyone want to speak publicly about this rule? Not, we'll close the public hearing. And Gary, well, I'm sorry, we have to have a motion to approve.
Move to approve the readoption.
Moving seconded. Now, Gary.
Dr. Armstrong,
Hi.
Keith Beard,
Aye.
Virgil Bremer,
Aye.
Dr. Gillespie,
Aye.
Dr. Hall,
Aye.
Dave Harden,
Aye.
Ty Harberger,
Aye.
Dr. Ragland,
Aye.
Tim Rice,
Aye.
and Dr. Doig.
Aye. Motion approved. So we'll go on to the animal health and animal care proposed rule now.
Yes, this is LSA document 25-279. And as you'll see, the public comment period for this rule ran from June 4th to July 4th. And we did not receive any written comments, so don't have any of those to provide you. And this rule is quite expansive. It touches on a lot of different areas in animal programs. So I will do my best to hit all the changes as quickly as possible. The first thing that it does is it amends the BOA official forms rule to align with the requirements for a CVI within the federal regulations. There were a few minor changes there that a lot of the language of defining it was kind of focused on hard copy CVI, so they made some federal changes and we aligned with those. The animal identification rule, this is really probably the biggest change. It requires official ear tags for cattle and bison to be readable both visually and electronically. It also requires a person who distributes official identification devices to enter the records into an approved database. It requires that records of official identification applied to animals by accredited veterinarians, markets, or dealers be kept in a readily accessible record system and sets for the standards for the board to access those records. It also amends the animal movement rule. We amend requirements for cattle to move into the state or intrastate from a slaughter establishment in a manner that's considered within slaughter channels in the federal regulations. It amends the BOA reportable disease rule to require a laboratory test to report a positive diagnosis of highly pathogenic avian influenza for all species. It amends the chronic wasting disease rule to allow an 840 microchip as official ID for reindeer. It amends the BOA Johne's disease rule to align the individuals authorized to collect samples in cattle with the applicable USDA standards. It amends the tuberculosis control and cervids rule to remove the tuberculosis testing requirement for intrastate movement of cervids. Amends the NPIP rule to update the incorporation of reference of the USDA NPIP regulations. And finally, the scrapie rule, it also amends to clarify that the identification requirement for wethers moving to an exhibition also applies to animals moving into the state. And finally, it amends the commercial breeder and broker rule to align with changes in the state law in the 2024 legislative session. So that just dealt with the number of dogs that was considered to be a commercial dog breeder. And I just want to emphasize the electronic ear tag requirement for cattle and bison. That will also be, it's also being proposed that it be for animals that are moving within Indiana. And so with that, I'm happy to answer any questions about the rule document itself, but that is a summary of all of the changes that are included in this rulemaking.
So in other words, we're really trying to just, on all these rules, update to go along with federal rules.
Absolutely. There's nothing that's in these that is beyond
That's
the federal requirements, other than I would say the intrastate for the cattle.
Intrastate.
Yeah, that's really the only additional state requirement.
Right. Any other questions for Sarah? Okay, we'll open this for public discussion. No public discussion, we'll close that, and we need a motion to accept this.
I still move to adopt.
Second. Okay, Gary?
Dr. Armstrong,
Aye.
Keith Beer,
Aye.
Virgil Bremer. Aye. Dr. Gillespie.
Aye.
Dr. Hall.
Aye.
Dave Harden.
Aye.
Ty Harbinger.
Aye.
Dr. Ragland.
Aye.
Jim Rice.
Aye.
And Dr. Doyle.
Aye. So motion carried. Thank you, Sarah. So, see all those thick pages that you asked about, it went pretty quickly. This time. Oh, okay. Now, ADDL.
Morning.
Good morning.
To you all, thanks for giving me a few minutes to update you on the lab. Hopefully you all have my one-page report. So just starting off with a quick financial summary. So moving into the end of this fiscal year, so these numbers are up to date as of the end of May. Our sales and services year to date are up 19%. always good news. Salary, wages, and fringes up a little bit, but generally strong there on the financial side to end fiscal year 25. Couple updates to share with you. So we had our AABLD audit in May. So this is every 5 years, a little stretched out because of COVID, but approximately every 5 years they come on site with the team. They audit us both at the West Lafayette lab and down in the EE lab. And while we won't have our report until the middle of next month, we're feeling real confident because it was maybe the smoothest audit I've ever been through. It was, we all felt really good coming out of it. So no, I hope I don't have to eat my words next month or next time I see you, but I'm expecting no major findings on that one. So that was really exciting for everybody. Everybody put in a lot of hard work. So we're proud of our team for that. Couple updates about the Reed lab. So that's our West Lafayette facility. You guys know we've started our big project to upgrade our necropsy floors. So phase 1, as I'm calling it, is the incinerator replacement. So the old incinerator is gone. We have some pretty cool pictures of the crane lifting it out of our basement. It took out the side wall to make that happen. The new one is in place. It's really big. Takes up the whole basement room if you've ever been down there. So I'm ready to fire it up, but they told me we have to connect things like burners and some other things. So not until September. We actually had a schedule. We said October originally, but now we're told they're hoping for the final commissioning of the new incinerator in September. So I've ever been ahead of schedule on a project like that. So cross your fingers. And then once that is up and running, then we will move into phase 2, which is the complete gutting and rebuilding of our walk-in cooler for animal storage. And then that should be completed around January, and then we can say that's done. So that's really good progress there. We also have engaged, as you guys know, with an architecture firm named Perkins & Will to assess our facility in West Lafayette. Basically, we asked them to tell us, what would it look like to renovate? What would it look like to build from scratch? Either way, we want that BSL-3 space, so that higher biosafety level laboratory space. And we don't have our final report yet. They're waiting on some pricing details for the final version of that. But I can tell you, based on cost, construction timelines, and the general final product, like the workflow, how the lab would be arranged, the report is going to be heavily leaning toward new construction. So again, we don't have it finalized yet, but that's the direction it looks like that recommendation will lean. So that leads me to my next bullet point. So there's a group called Hanover Research that we have engaged with. They're basically a data analysis company that we have contracted with to do basically a broad market analysis. So they've broken into 3 distinct projects. So starting with a market analysis and looking at Indiana at large, all the different sectors that we serve. Then we're going to move into an estimated return on investment study with the facilities in mind. And they're looking not only in West Lafayette, but for the EQ lab as well. And then finally, some competitor benchmarking. And so our hope with this is to have data we need to make a final decision about what direction we're going with facilities, and that will help support whatever future asks we may have regarding facilities. And the last bullet point under my updates is our LIMS replacement. So the other big project we have going on, so that's our laboratory information management system. Ag Lab was selected. So that's basically the sister product to USA Lift. Did I say the right word? Is that the new name?
Ag Enterprises.
Thank you, Ag Enterprises, that BOA uses. And so we have begun our implementation. It's very early. There's a lot of details to work out. We're shooting for a February completion. We'll see, but we're rolling. So we'll get that online eventually, maybe early next year. And then I always just give you a little update on positions. So we have a faculty pathologist position we've been searching for a while. That has been filled by one of our recent residents who just finished last month, Dr. Sakashita. He's going to start September 15th. And I'm very happy to tell you we have filled our client services veterinarian position. That was a long road. Dr. Dineshi is going to be joining us from North Dakota State University August 12th, so right around the corner. So we're very excited to have somebody in that role. We have 2 faculty searches underway, one for our poultry diagnostician and one for our molecular diagnostics section head. Both going through the process of searches. So we have candidates. I think interviews will be scheduled in the near future. So stay tuned for more there. And then we have one technician position open right now, which is a pretty low number. So happy about that. So things are moving forward. And then the fee changes that you approved back in April went live July 1st. So I have nothing new today to propose. And my plan is still to do this once a year as far as a global review. I think I might have a few next quarter to share just for some new tests or some things we're reorganizing, but no big list of tests to approve until next April. And that's it from the lab. Any questions for me?
Thank you.
You're welcome. Thank you.
Denise,
Good morning. You have my report. You also have a little supplemental sheet that I was going to just highlight that what we're doing in the Indiana Veterinary Workforce Initiative is what we're referring to this as. So it's been a while, even back before we became the Indiana Center for Animal Policy, that brought our sister board with the Veterinary Licensing Board under us. With the formation of that, one of our main goals was to increase access to veterinary care for all Hoosiers. And so we've kind of been working on this in different ways for a couple of years now. Things stepped up a bit about a year ago when the Farm Journal Foundation approached us about working with them on a national program they have going, where the third state that's completed an assessment of factors that are leading to shortages of veterinarians in the food animal rural practice space. And so we've joined with them, and we've kind of taken a three-pronged approach to trying to get a handle on this big situation that has lots of reasons, and depending on who you talk to, what's the source and what's going on and how to solve it. And this is just to highlight some of the things that are happening at the moment as far as how we're proceeding. We've formed a working group to look at different aspects, and these are different initiatives on our three-pronged approach. As you can see, it's our agency, State Department of Ag, the Purdue College of Veterinary Medicine, and the IVMA have all joined forces with us on that. And so our three-pronged approach, first coordinating, we're trying to just use that working group to coordinate what's going on and who's doing what pieces, because each of those groups has something to offer in trying to address this situation. And also, and again, under coordinate, we've got noted that the Farm Journal Foundation has done an assessment. We're the third state that they've done this for. They've got a whole package and a suite of things that they've done as far as talking to stakeholders, trying to look at some of the licensing data, just what's available, and trying to gather that in one place and giving a report back to us. We're going a little bit further in assessing the situation, trying to encourage more participation in the veterinary educational debt loan repayment programs. Of course, there's two federal programs. You've got the VMLRP and then the Veterinary Services Grant Program, which has been woefully underused in Indiana. We're only aware of, I think, one clinic that's taken advantage of that. The VMLRP we've been doing for more than a decade, I would say. And that basically is geared toward food animal practitioners who have to have a significant amount of time in that food animal practice space. But we have to identify, our role is identify areas of need and within the state and the geographic area, or maybe a vertical space, maybe like poultry production or something like that. Provide those to USDA for them to approve, and then they will post those as openings or spaces that veterinarians can apply to get their loan repayments made. And we've been very, very successful in Indiana. We normally have about 5 of those approved spots to get posted. They don't necessarily all get applied for, unfortunately, nor awarded, but that's, we've had a pretty good track record there. State-wise, we do not have a veterinary loan repayment program at the state level. That would, as you may recall, I think a year ago, we had legislation that went through asking to at least get the language there on the books to make a fund or a space for that to happen. That did not get approved, so we don't have anything at this point there, but that's something that could, going forward, could happen again. It's just going to take legislative action. We work to gather insights on veterinary deserts in the state from the practitioner's point of view by surveying the Category 2 USDA accredited veterinarians. Those are folks who are most likely to be doing that food animal work to get some sense of where those veterinary shortage areas are as far as providing coverage. And there's more work to be done there. We're also have been, for you veterinarians in the room, you know when you go to renew your license, we're asking a series of questions on the front end of that about demographics, things like how much loan debt, are you in a specialty area, those type of things. All of that to help build a profile of where the veterinary workforce is, and we'll do something similar when the registered veterinary technicians renew their registrations due by the first of the year in 2026. But all of that comes together. So we've got the veterinary licensing dashboard, which we did this 2 years ago on that renewal cycle, and we've got that dashboard is on the Indiana Center for Animal Policy's website. You can access it there. We're going back and doing it again, so hopefully over time we can build a data set to show what trends are. Are we running short of veterinarians? What percentage of them are likely to retire in the next 2 years? Who's leaving the practice? How many are coming in? Just all of what that looks like there. It's very, very similar to what is happening in human medicine, because they're like the Bowen Center for Public Health has been working on that to make sure that human health services are met as well and see where that brain drain or the workforce future is going. So we're trying to do something comparable. Again, we're engaging with key stakeholders. We're working with Indiana State Department of Ag. They do a lot of meetings during the state fair time period to meet with stakeholder groups and get feedback. So we're going to be on their agenda with this information as well, and make that as good listening space. Also new, we are seeking input from the public. So if you or your colleagues, others you know, the public, even pet owners, anybody, if you're having concerns, suggestions, issues, thoughts, stories to tell, we've got an online public comment space that folks can go online and just submit what their experience has been with finding veterinary care. And again, that's on the Center for Animal Policy's website under the Veterinary Workforce Initiative. So folks can go there and just offer if there's concerns or something there that they need to do. So those are kind of the action steps we're taking to assess what's going on in the situation overall. And then third prong is implementing. So we are encouraging use of the Farm Journal Foundation. One thing that they've developed in addition to doing this assessment report, they've made educational models that can be actually integrated in classroom settings to help encourage young people, or anyone, not just young, I suppose anybody can do it, to seek a career, particularly in food animal medicine. And it starts with modules that can be used in high school classrooms. There's one for college, like geared toward undergrads. There's also another for veterinary students to encourage them to track that way into food animal. And then they also have a fourth module set that's for early career veterinarians to help them, if you've chosen to go into rural practice or large animal, how to survive in that space and make sure that you can thrive there as well. So that's another one we're actively working with FFA and others. And then finally, the other big piece that we are currently working on, and veterinarians are going to see a survey coming out as well. We would like to build a Find a Veterinary practice search tool that would be accessible on our website. We get calls or emails from people who say, I have a llama and I'm in Franklin County and I can't find a veterinarian to, service my animal or something like that. So we typically, what happens, we get those type of calls. They're seeking veterinary care. So we get a lot of anecdotal information about where the deserts are. But I'll contact our field veterinarians in that district and like, hey, do you know anybody? And they'll they'll run through their list through their head, or like reach out to a couple private practitioners in the area, or they maybe know somebody who does horses and say, well, yeah, I'll see a llama, bring them over, or something like that. So we're going to make this more accessible if we can, and this will be voluntary participation for the clinics. You can list in if you want to, or you can pull out at any time, but basically It'll be a search tool so someone can put in what area they're in, what species they're seeking, and then get a results of who can be available to see their animals there as well. So we're hoping this can not just increase market access for the practitioners as well, but also to help citizens find the care they need where they need it as well. So those are all things that we have ongoing. There is a QR code or the website, take your pick. You can access what we have up there and just whatever resources and links to the dashboards and all that. But happy to take any questions.
Thank you.
You're welcome.
I was a little disappointed in the fact that the legislature did not approve, from our requests and everything. Hopefully that will come back up and get some way to pay back some of these.
And the federal program's currently on hold, so we're waiting for those funds to open up, so.
Okay, Gary.
Yes, Mr. Chairman, members of the board, just want to hit some points that's in my written report. On the first page there, we've had quite a bit of work put it in to respond to some directives from the new administration. So Governor Braun issued several executive orders as he came into office, and a number of those required things of agencies. And so we've been working on that in a number of different respects just to hit some of those things. I mean, we've issued responses to provide information about DEI. The agency has reviewed and modified and established what we call KPIs, or this would be the top level performance measurements for the agency. And actually the second document in my report is a copy of that, what those turned out to be. These are based on metrics that the agency had prior to this administration, but we've reviewed them again and modified, tweaked them a little bit here and added a couple things. So as you may, if you've read this, you may notice these are very high level and kind of across the top level of the agency. For every division, of course, there's lots of metrics for each of the programs within those divisions. So for instance, for animal health, obviously the agency's goal is to be to have the highest state status for any particular disease control program that you can have for a state. So that's kind of the overall goal, the overall metric for those. But of course, every disease program has its own metrics in terms of what's required to get to that. And so those obviously aren't listed. And then also we have for the poultry division, this would be a new KPI for the agency. And it relates to the biosecurity audits that are required in order to maintain status in the NPI program. For animal programs, animal care, this would be a new KPI for the agency. It talks about the number of animal care investigations that BOA is involved with that result in a positive outcome for the animals. So then the division is coming up with how to define that, or how do you measure that. And they've got some good work on that. And as we start to implement this, eventually we'll bring some reports back to the board on these things. But and then the second one's just a application processing time metric. So how long does it take from the time that a completed application is provided at the agency in order to issue that registration for those different entities. For dairy, I think this one I think they've been reporting on in their board reports for a number of years, so that you may notice that you've seen that one before in terms of the enforcement scores that they get when the program's audited, either with the internal audit or from the FDA. And then we've added it again for them on the second page there, just application processing time metric for each of those different approvals that they give, whether it's for construction plans or for the licenses themselves. Then for the meat and poultry inspection division, we've been tracking this for a while, but we've made it a KPI officially, I guess, and that's just the program through the federal computer system gets a number of directives, I guess you might call them, or instructions or assignments. Assignments may be the right word. in terms of, so the program tracks the number of inspections that it completes and those that are missed, so to speak. And so that's something we've been watching just in terms of our limited resources and limited personnel. And so that's one of the things we keep an eye on, just to see how that's impacting our ability to meet those different inspection assignments. So that's the metric for poultry. And then we also have one for the veterinary board in terms of the application processing time, from the time we get all the information that's required to the time the license is issued. So those have been submitted to the administration, and we are certainly will be keeping track of those within the agency. We're not sure yet how exactly that information, or if that information will be reported to the governor's office, or if that will be publicly published. That's not sure where that goes from here, but those are the metrics we established for the agency. Other executive order items, prepared a government efficiency report. That was kind of a pretty extensive report. Essentially, we had to describe the purpose for everything the agency does, the duties that are required from the agency in every program the agency does, and how that's accomplished in some detail. So there's quite a few pages to that, and that was all submitted. And then essentially, what does the agency do? Why do you do it in every respect? So that's been submitted. Job requirements for the agency positions. We don't have many positions in the agency that require a college degree. Obviously, some do if you're a veterinarian, then obviously that was required to get there. But in terms of our inspection positions, we have some that the degree is preferred, but it's not required for any of them. In fact, particularly for our meat and poultry inspectors, we essentially know we have to train our own, and so we're looking for folks with the right kind of background, and degree isn't necessarily required for that, but that's the same for most of the positions in the agency. Executive Order 2516, this is the return to office. And the prior administration, there was what they call hybrid opportunity. So if the person's position, normal workstation was here in the office, there was an opportunity to work 1 or 2 days from home. That's been eliminated, so there's no longer a hybrid opportunity. Of course, most of the agency employees work from their homes across the state. They try not to come to the central office. They don't like to come to the central office. And so those folks were not really considered remote workers because they work in the field. That's where their post is. So under the new policy, folks who work in the central office, they are required to be here 5 days a week. So there's no more of the hybrid remote work option. Then some additional clarification on our field staff, those whose post is their home. They do require them now to keep track of the hours they spend in the field and the hours that they spend at their home doing reports or whatever. So we've implemented that, and so that's gone fairly well. Although there's some folks who would prefer the old way, but we're good with that. Let's see, 2015, 17. This is. You'll hear more about this, particularly at the next meeting. Sarah spent a lot of time working on this. Essentially, we've had to review every rule of the agency, or come up with a plan to review every rule of the agency over the next 3 years, getting rid of the ones that are no longer necessary. That's the rulemaking plan. There's also a new schedule for readoption of rules. I think you've been on the board for a while. You know that every 7 years we've been readopting rules. So now it's every 5 years. It's actually a little bit shorter than that. You got to start before that. And then there's an extensive process you go through. There was always a process to analyze the rule and whether you continue to need it and so forth, but that's been supercharged, I guess you might say. And so there's a lot of, there'll be a lot more paper at the next meeting describing the different rules of BOA, things that we need to continue to have and why and so forth. So you'll see more on that. And then the occupational licensing requirements, we don't have a lot of that. Of course, the Board of Veterinary Medicine is one, but outside of that, we don't have a lot. There are a couple of dairy permits that relate to someone who's picking up milk on the farm and so forth. So we've issued some data on that. So before I go on, any questions on all this executive order
I'd like to thank Gary and Sarah and everyone involved in this, because in the past, you've had to do this not quite as much detail as you have this year. So it's taken some time. So I'd like to thank everyone involved in doing this extra work on top of their normal work. So it's put a burden, on some for some of this. So thank you very much.
Happy to do it. We'll see where it goes from here. Moving on to budgets, we closed out the fiscal year 2025 as of the end of June. So the agency was fine in terms of meeting the budget goals for that year. As we start the fiscal year 26, we had to create a spending plan and submit that. Of course, as I think I mentioned, but I'll remind you, the line items for the agency for animal health and for meat and poultry were flatlined in the biennial budget bill. However, there was also provision in there that required a 5% reserve from agencies as determined by the administration, the Office of Management and Budget. So for the Board of Animal Health, the animal health line item, which is everything except meat and poultry, is subject to a 5%, mandatory 5% reserve. There's an opportunity to request a release from that if you want, although they stress you better have a very, very, very good reason. It's not likely to be granted. But then for the meat and poultry program, we were not required to have a 5% reserve because the budget agency understands where that program is budget-wise, and so that was helpful. So we submitted a plan essentially for the animal health side of that. That means there'll be 3 positions that are not filled, but after people retire, 2 of those folks have already retired, and 1 more coming. So we think with that reduction of 3 positions, we should be able to meet the reserve requirement in all programs. Of course, as you recall, the Animal Disease Diagnostic Laboratory budget came through the Board of Animal Health this time around, the annual budget. So that 5% reserve applies to not just state agencies, but also applies to colleges, state-supported colleges, and so it does apply to the ADDL's $5 million line item. So that they've also contributed to the spend plan, how they're going to meet that reduction. And then we have the ADDL capital projects. Capital projects for state agencies this time around, rather than the General Assembly prescribing that, yes, we're going to this, and this. They said, okay, here's a pot of money. I think it's $260 million. Administration, you figure out how you're going to spend it. And so all the agency capital projects are all in line, so to speak, waiting on the administration to decide how they're going to allocate that relatively small amount of money across all the projects. So when we get the opportunity to raise our hand, so to speak, we'll put the ADDL projects back in there and say, yes, these are important, this is why, and we'll see what happens. So at this point, we don't have a process for that. I think the administration's trying to figure out how to manage that. As I mentioned, the meat and poultry line item from the state is flatline. We got good news, at least in the press, that the USDA has found $14.5 million additional dollars for state meat and poultry inspection programs in the fiscal year, current federal fiscal year. I think that will also be there in the next federal fiscal year. At this point, though, we don't have an allocation of that, and so we don't know of that how much additional funding there will be for the state of Indiana. I would guess that we'll maybe know that next month. I'm not entirely sure what their plan is. The usual program is that around August, they ask you how you're doing, and if you need additional funds, let us know. And so I'm assuming that they're going to incorporate this new money into that normal process. And we'll see. We're hopeful that that will bring them up to 50%, or at least bring them up to the full participation by USDA for the program, but we'll see. And then, of course, if we're able to do that again in the next fiscal year, federal fiscal year, that'll be very okay. Cooperative agreements, obviously went through a period with the new federal administration where the federal funding for any federal program was uncertain. And so we've been through that with respect to meat and poultry, but also with respect to the cooperative agreements we get for animal programs. And so I'm pleased to report that all of the proper agreements that BOA participates in with USDA for animal programs have been funded for the next go-around. And then we got, and those are usually on an April to March timeframe. But then there's also a chronic wasting disease program that we've been participating in, and that we just found out recently that they will do that again. So we submitted our initial ask for that program. And I think that's all I had for the board today, unless there's questions.
Any questions for Gary? Thank you again, Gary, for everything that you've done. High Path AI, who's going to talk? I never know on this one.
Yeah.
Hello, everyone. I don't think I've met everyone, but my name's Brandy Hardin, and I'm one of our senior directors in the Animal Programs Division. I'll be filling in for Kelly today. Dr. Berlin's on vacation. So for our report for highly pathogenic avian influenza, we wanted to report that Indiana did complete its final round of negative testing for the milk. So we have applied and have been awarded the unaffected status here in Indiana. So to keep that going forward, we will be conducting monthly testing of our milk tankers. Here, that's kind of the avenue we chose to go to kind of help trace down things if anything would ever need that. But other than that, that's really kind of all we had. There is a little diagram in here that tells you what states have been awarded that unaffected status, and I think that's very helpful. So other than that, we've just been, really planning for that with our dairy division. We are working with the plants. The tankers are arriving there before they go into the silos, and then those plants are collecting those samples, and our dairy inspectors are bringing those to the office here for processing. So 2 days a month, yes. Yep. Awesome. That's all I have.
Waiting for fall for migratory birds.
Yes, I'll let the avian folks cover that one for sure. Any questions for the milk testing strategy? Perfect, thank you.
You don't see Brandy in here much, but she's a workhorse and played a whole lot of role in the avian division's life the first few months of this year. So we're glad she could join us for a quick report. Fortunately, as well, I'm happy to stand up here 3 months later than the last board meeting where we reported coming off of significant activity in our domestic poultry in Indiana. So fortunately for April and June, we had just one case of avian influenza in domestic poultry, and that was in a flock of around 360 birds up in Porter County. So we've had a little bit of time. I don't want to say that we've rested, but comparatively speaking, we've rested and tried to get back after tackling other things that we need to do as part of our daily duties and catch up on other things. So we were fortunate to just have that one flock. Additionally, back on May 27th is when we were able to proclaim for the state of Indiana HPAI freedom. And those are per the standards of the World Organization for Animal Health. And really what that does, and so basically we can proclaim that after it's been 28 days since initial virus elimination has occurred on our last poultry flock. So once we've made that countdown, we can claim that freedom, and what that allows is often easing of restrictions for trade. It doesn't automatically take away everything, but there's a number of countries that look at the state level or an even smaller region, like a county or something like that. But for the state, we had a lot of people eyeing it for Mexico and in particular Canada. And so usually within the first week after making that announcement, it gets published in a situation report, and then we start seeing some of those restrictions lifted for our producers who are wishing to put poultry or eggs, hatching eggs or table eggs into international commerce. So we were glad to meet that milestone and not have to take it back, because that's always my fear, is that we're going to proclaim it one day and then later that week or the next day or whenever we're going to have to take it back. So we've had a little bit of a reprieve. A lot of what we're doing now in terms of this, what we'll call downtime, is trying to catch up on our inspections for the National Poultry Improvement Plan. We help the Indiana State Poultry Association do those, or not help, we take charge of those. We've also, when we've been going out to do those inspections, we've been spending a lot more time speaking with our Indiana companies kind of about our lessons learned and increased or changing, policies or procedures as it relates to avian influenza. So trying to use that time to really chat with our companies, and Dr. Shipman has been joining us on several of those endeavors. So we'll have actually a couple more companies that we're visiting this week to discuss some of those things similarly. One other thing specific to avian influenza to mention is, so it was back really in February that Secretary of Agriculture Brooke Rollins had announced a 5-pronged strategy for avian influenza. And so now there are other 5-pronged strategies. I'm not sure if everything is going to be a 5-pronged strategy, but for avian influenza, a big piece of that one was essentially expanding the voluntary biosecurity assessments that our producers, particularly commercial producers, can partake in. So you may or may not remember the BCAP program, the Biosecurity Compliance and Audit Program that went into effect December 31st, right before our event happened. Those were biosecurity audits that had to be completed if a producer was going to place birds into the buffer zone of a control area. And also, if they were a previously infected farm, we had to complete those BCAP audits. So between Chelsea Leatherman on our team and also Mike Kopp and Isaac Trainer, BOA completed 101 of those for the first few months of the year. And then since then, 62 more have been completed as part of this voluntary program, which is kind of divided up into kind of, I guess, 2 main categories. So one is a wildlife biosecurity assessment, where they come out and they do help potentially from the outside at identifying risks and such for wildlife incursion or entrance onto your farm, and what kinds of things can be done to prevent those. And after a wildlife biosecurity assessment is done, those producers can also request basically abundance surveys of wildlife at their premises, and then direct control measures can be done by these wildlife services folks. So direct meaning lethal and non-lethal mechanisms of decreasing wildlife, which may serve a role in transmission of avian influenza. So the other one then, so there's the wildlife piece, and then there's what's called a BIFA. It's basically the same thing as our BCAP audits that our team did. In fact, it uses the same tool, but it has a different acronym because there is basically incentive and cost sharing for improvements or corrections that you make to your structures or facilities or protocols, etc. So USDA pays up to 75% of those in a certain tier, the tier being kind of the most important tier. And then we recently learned that they'll also, if you've done all the tier 1 recommendations, they will also look at cost sharing those at a lower tier. So we've had 62 of those, voluntarily conducted by our producers in Indiana, and that represents 9 companies who have utilized those. And overall, the feedback has been very positive. So we have not been on site to participate in those. It's been USDA staff who's also pulled from a variety of branches within USDA, but we correspond mostly with our state wildlife services director, Lee Humberg, as it relates to the wildlife biosecurity assessments. And overall, positive feedback. Only a couple that have had some, recommendations for improvements or change, but I know, Ty, your facilities, you guys have welcomed some folks out to your sites to do these and have given positive testimonies. So we are hoping to see that continue to increase. I would say our large layer operations have been our biggest, those most quick to uptake these voluntary assessments, but part of that was because that was very much the aim to begin with, was let's take care of these, kind of a most bang for our buck, our larger operations. And then from there, others are starting to come on board as well. So just a note, so our 101 at BOA plus the 62 brings us to a total of 163. That's now third in the nation in terms of the number of biosecurity audits that have taken place. So we've had about 16% of them. We were fourth. That's, I think, what it says in my report, but we came, I think, ahead of Pennsylvania. So yeah, it's not a race or a competition, although I will say some of the promotional information or even direct from USDA Secretary Rollins' desk, it kind of makes it sound like it's a bit of a competition because they very much will say like, yeah, here's the list of states and how they rank in terms of the amount of poultry in them, and here's the rank of states and how many of these biosecurity assessments they have done. So they definitely are looking and comparing, and we're doing well in that realm. So prediction for the rest of the summer and the fall, I mean, I think I've said for a couple of years here, it's probably not something you want to predict, because as soon as you predict something about these avian influenzas, you get proven wrong. So, it's been nice to have the reprieve that we have, and I hope that we can stick with it. And, someone said, what if, this was, so I think, was it last Friday, we got a report for the first time, we were double negative for the first time in a long time. And what I mean by double negative is that there were no reported domestic poultry or domestic livestock cases across the country, which it had trended very significantly downwards. I think May, June timeframe, Arizona got hit pretty significantly, which was very alarming. And then there were continued dairy cases, particularly in Arizona related, as well as in California. And then at the beginning of July, there was a 30,000 bird case in Pennsylvania. So it's still out there. And we just hope we'll go without it for as long as possible. So I think that's primarily what I have as it relates to avian influenza, and happy to take any questions. Okay. So for the rest of my board report, we continue to see plenty of cases of avian metapneumovirus. At this time, USDA Center for Veterinary Biologics has allowed the import of 2 killed vaccines. So these are, again, foreign produced vaccines for avian metapneumovirus. So 2 killed and 5 modified live, as well as domestic production of 3 experimental autogenous vaccines. So we are glad to have products to try to battle this. At this point, we're largely receiving positive feedback, but we've also heard someone say maybe it's not as great as what we'd hoped it would be. So I think there's still time to tell as we, get breeders vaccinated and some of this modified live just, getting into the hands of folks to vaccinate meat birds. So we'll see where that goes. We certainly still think that other cases of disease that we are seeing could very much be as a result of or made worse by avian metapneumovirus. So primarily, again, this is affecting our turkeys most significantly, but a lot of our pullets and layers are also doing testing, particularly antibody testing, and seeing very high titers. And then so it's trying to determine how much is this clinically actually an issue, or are they seroconverting and not really, succumbing much to the disease. So we'll see where we go, in the next year, now that we have more solid supplies of vaccine and time to get them into protocols. Our own outbreak of Mycoplasma gallisepticum in turkeys in Southwest Indiana has come to what I'm considering an end. This quarter, we did have one additional case in Greene County. So prior to that, they'd all been in Davies County, but Greene County nearby saw an additional case. But since then, we've been able to lift all 11 quarantines, and we've maintained our MG-free status for the state of Indiana for turkeys. So glad to hopefully knock that one off the report and not report on it for a while. And then we have not had any laboratory diagnosed cases of egg drop syndrome virus in Indiana over the past quarter, maybe 2 quarters. Off the top of your head, Cop?
It was the end of last year.
Okay. So last 2 quarters. Now, that doesn't mean that we don't have egg drop syndrome anywhere in Indiana. That means that we're not aware of a big problem, and some of that could be, I mean, a lot of it, of course, attributed to vaccines. So while we don't have it, it has continued to be found in some other states. So you may remember back in 2019 is what we decided was our first case, I think. Oh, did I say 22?
22.
Okay, that's really bad. I'm 3 years off. We were just discussing this in the truck ride home from a visit this past week. But so 2022 was our first case of egg drop syndrome, and at that point, we were only aware of it being in a couple of other states. But now it has unfortunately made its way into several states in the country, and so what that means for us is that there's a higher demand for the vaccine. So one, we still worry about vaccine availability and quantities. And then two, a greater demand perhaps for our vaccinated pullets in Indiana. So when we start seeing outbreaks in other states, they want vaccinated stock to come in. And now we're also getting a lot of questions from other states saying, hey, can we ship vaccinated pullets to your state? Which we are welcoming. So hopefully it continues to not be a problem for us, but just keeping in mind the potential for vaccine availability becoming an issue as it spreads across the United States. I think I've largely covered everything that I wanted to, but open for any questions or any topics I might have missed.
The reason that we didn't ask questions about avian influenza, it's kind of like bull manure. The more you stir it, the more it stinks.
Yeah.
So that's why we were
Yep, just leave
very
it.
quiet on that.
Yep. We had our fair share for a while.
Thank you.
Thank you.
Okay.
Awesome. We'll go ahead and get into the Animal Programs Division report. So just a few things that we wanted to highlight from this quarter. So in cattle, BOA did receive a TB trace for 48 dairy cows that moved from Texas to a single site in Indiana. They did move it here in October of 2023. The site did account for all of the 48 head. There were 35 still on site. It's kind of broken down in the packet there, kind of where they were at. We did caudal fold test all of those animals, and they did test negative. So next steps is that we have been working with the USDA cattle health team to kind of decide what the next steps are, and we are moving them to slaughter. So that is where we are at there. In our companion animal space, we did have a unique inquiry about a veterinarian in Greene County reached out to us, and they potentially thought that there was HPAI or high path in cats. And so after diagnosis and things, there had been 10 to 12 cats in the practice that kind of presented with clinical signs that they thought could be consistent with that. But after a few were submitted for necropsy, we actually determined that they were diagnosed, I'm not going to try to say the name, but with bobcat fever. I'll let you try to decipher that. So bobcat fever, you know, it's transferred to cats by tick bite. So bobcats can carry the virus, the ticks bite the bobcat, and then it bites the cat. And then unfortunately, death can occur in that space. So that was kind of an interesting one for us here at the Board of Animal Health. Alrighty. And then something to look forward to. So BOA will be conducting a high path after action review or a hot wash in August, and we're going to critically evaluate all of the aspects of our response and kind of work together as a team to determine how we respond better in the future, you know, wins, losses, things like that, so that we can kind of identify those areas and be better going forward. So that's just something to look forward to there. But other than that, that's really all that we wanted to highlight. I will say we did have 2 summer interns with us, and Hudson is here today, and he does, if we can like ask questions or if you have them, I'd be happy to answer them, and then we'll let him come up, share his experience. And Emma unfortunately was unable to be with us. I'm sure Hudson will touch on that, but if there are any questions about the Animal Programs Division report, I'd be more than happy to take those at this time.
I have one question.
Yes.
The EIA tests that were lost during shipment,
Yes.
Can you, a little more explanation on what happened to them?
Yeah, do you want to help me out on that?
Yeah, I know.
Yes.
Yeah. FedEx lost them.
Yes.
That's it?
Uh-huh.
Never
End
found.
of story.
Okay.
So. Yeah, they're gone.
Quick answer.
Awesome.
Unfortunately, we've had that on, this one was particularly painful, but we've had that a few other times where they just are no longer able to track them in their systems, which is disappointing.
It happens. I mean, the explanation is, there should be an explanation.
Sure.
I mean, that's through the tracking, there should be an explanation. This is just a personal thing, and it was UPS rather than FedEx. I got a phone call from people who lived about 20 miles north of me in the county one day, and we found 3 boxes addressed to you in the ditch by our field where we're farming. So luckily I knew these people and they brought them to me and everything. So I went back through UPS and it was late in the day and the guy didn't want to do it. So he just threw them in the ditch. Needless to say, you guys know me well enough. He lost his job. But there's, I don't understand no explanation. I mean, and I understand it can happen, but I don't. So anyway.
We've had environmental samples back in, I think, 22 that we shipped, which we don't generally ship now. We courier them to the lab, but shipped them from southern Indiana up to ADDL, and they got diverted through Denver. Somehow that's the direction that, we'll say, plane goes, because I don't know why they were on a plane, but by the time they did get them, I think eventually back, but it was like 10, 14 days after, and the samples were, I couldn't run them then, but
at least that was located and
exactly.
This is what I don't understand is the
Like,
lack
where
of
did they go?
total. Okay, I'm sorry.
So we just intervened because the practitioner shipped them, right?
Sure.
And so she said, I don't have them anymore. And yeah, so to get the status of those horses.
Any other questions? Okay. Hudson, would you like to come on? Okay, perfect.
Up here is good.
Yeah, that's it.
Okay, hi everyone. As Brandy said, my name is Hudson Heil. I am one of the 2 summer interns this summer with BOA. So as Brandy said, Emma is not here today. She's at the AVMA conference in Washington, D.C., I think. So she is currently there, but I will go over this presentation. If you have any questions, anything comments, stop me in the middle of this and we can go over anything. This presentation, it's gonna more encompass the field opportunities that all of us, or that me and Emma have been on. A lot of the field veterinarians, animal health specialists, people like that took us on all these opportunities, tours, welfare investigations, all of that. While we're in office, we're working more so on our summer projects, working in USDA or USA herds, and as well as with the national milk testing strategy and other things like that. So yeah, next slide.
Trying to figure out how to click it.
You're good. So, also real quick, I'll be going through all these field opportunities and everything we've done, but I don't know if you guys have access to it, but we have an intern field journal that gives a much deeper, in-depth description of everything that we've done this summer. This just does a couple and very brief overview, but if you want to look at that, me and Emma each have our own descriptions on everything we've done. So, but yeah. So as I said before, my name is Hudson Heil. I'm a Purdue 2026 animal science student. My concentration is in production and industry. So I plan on finishing my degree and pursuing a career with either the federal or state government, hopefully. My career goal is to be an animal health specialist or related career. I do have an interest and have worked with poultry, So I could see myself doing something with regulatory medicine or related career in that. Honestly, any good opportunities that come my way, I'm happy to accept. So some of the projects that we've been working on, or I have personally been working on, is updating the HPI Poultry Case Manager documents. That has all the files, making sure they were organized, updated, all of that. And then as well as the Indiana Animal Investigations Academy poultry modules. These presentations are going to be used. They are the care and concerns modules on that. And then one of my favorite experiences so far with BOA has been assisting the DNR in banding and sampling of the wild geese. That was a really fun experience. There's a ton of other ones we've done as well, but that's just one of them. So, yes.
Where are you from?
Oh yes. So I'm from Southern Indiana. I'm from Jasper, Indiana. So big poultry area. But yeah. So this is Emma. She is a Purdue DVM 2027 student. She intends to practice as an accredited large animal veterinarian with interest in regulatory and veterinary forensics. Her career goal is to become a regulatory veterinarian. She has experience in the Animal Agriculture Alliance's College Aggies online program and has ignited a passion for her consumer education. Some of the projects she's working on this summer are the social media post for BOA's Facebook page, updating the internship information on the BOA webpage, and the New World Screwworm YouTube video. And her favorite experiences so far have been assisting Dr. Strasser with the necropsy on a dairy cow, and or assisting a couple of the field veterinarians and animal health specialists with some scrapie sampling. So some of the opportunities that we've been to a couple carcass disposal site inspections. The first one we went to, this was probably a week or two into our internship. We went to the Exotic Feline Rescue Center. We completed a full tour with the owner, Joe Taft, and we had an opportunity to see how the carcasses are properly stored, thawed, divided, fed, and composted. We got to see, we got a tour of their new veterinarian facility or clinic that they just built up, so that was pretty interesting to see. We also got to visit the Red Wolf Sanctuary and Raptor Rehabilitation Center. We got a tour of this place as well and found out that they no longer use livestock carcasses for feeding anymore, so that's something a little interesting. Food safety inspections, we visited Nestle, Prairie Farms, and Dandy Breeze Creamery. So we went on tours of each of these facilities and we observed the milk and water sample collection processes at all three of them. I thought it was really interesting with this day. We did them all in one day, and seeing the kind of size and scale differences of each of these different facilities is incredible. We also did the NPIP inspection and biosecurity review at the Wabash Valley Produce. We went down there and we had attended an audit with them, and we also got a tour of their property and their new ready-to-eat facility that I think had maybe been going on for about a week when we got to tour it. So it's pretty cool. I don't think many people have got to see that yet. Disease traceability. So Emma, I was doing something else this day, but Emma got to go with Dr. Strasser on a bovine TB testing and postmortem. She was able to see the TB testing process in the dairy cattle and assist with RFID tag readers and data reporting. She also assisted Dr. Strasser with a postmortem exam and sample collection on the cow. We've also been to a rabies lab visit of the Indiana Department of Health Laboratory. We've been there before, dropping off the milk test and all that, but this time we got a full tour of the entire facility. Kind of how with my experience, I said we did and went wild waterfowl HPI sampling. We assisted the DNR with goose capture, banding, and sampling. And yeah. And then we've attended a couple professional meetings and some coming up. The Indiana Ag Intern Development Day. We were invited to this. This was the first ever Indiana Ag Intern Development Day, so we're glad that we were invited. This was with Indiana Beef Cattle Association, and we had the opportunity to meet other interns, do a volunteer activity, and learn from other industry leaders. We've also attended the Indiana Pork Board and ISPA board meetings. We had an opportunity to sit in on these board meetings, listen, and network with a couple industry leaders. And then next Thursday, we have the ISPA Poultry Intern Day that me and Emma are looking forward to. So that'll be pretty exciting. And then a couple activities that we've been on and helped out with. The boiler vet camp that BOA puts on. We assisted Dr. Whirling at the PPE station. The vet campers had the opportunity to don full PPE, practice oral swabbing of rubber chickens, and then they got to test out their PPE integrity with water guns at the end. We also attended the Awakening of the Wabash full-scale exercise. We were invited, we went with Dr. Whirling to the EOC during a simulated response to a 7.5 magnitude earthquake. BOA serves as the Agriculture and Natural Resource Emergency Support Functionaries there. And then a couple visits that we've been on. We've been to multiple, but these are just a few. We went down to Horseshoe, Indianapolis. We followed one of the racetrack veterinarians, Dr. Mann, through the barns as he administered like joint injections, pain medications, IV fluids, and more, checking for inflammation and bleeding in the horses after they had raced. We also watched thoroughbred and quarter horse races and rode along with one of the federal veterinarians while the horses were racing and then after. We also visited the Topeka Horse Auction and Rochester Sale Barn. We've been to Wolf Swap Meet as well, but we traveled there and we got to go with Ron Paul to experience some of these sale barns environment and learn kind of about what the animal health specialists do within those fields and in those areas for BOA. And yeah, that is pretty much it. I just want to say thank you all for all these amazing experiences. I know not all of you have been around. I haven't met all of you yet, but this internship has really helped with a lot of hands-on skills, things that I learned that I've personally never got to experience before that I hope I can use in my future career, both me and Emma. So we're finishing up. We've only got a couple more weeks left, but we're excited. And yeah, thank you again for putting this on. So, and
I hope I'm going to lecture now.
that's fine.
I hope that both of you realize that Indiana's Board of Animal Health, I will put up against anywhere in the country. We're tops.
Mm-hmm.
And you are working with people here who have worked for several years in their area. And you're being trained and taught by tops. So I always tell these people who are sitting here the same thing every meeting. And they may get tired of it, but I hope they appreciate me thanking them. But just realize who you've been able to work with.
I will. Thank you.
I'll quit lecturing.
You're good. Any other questions, comments?
We won't ask you what your favorite species is.
I will.
If you put up with that guy.
Just another comment. Hopefully you both stay in Indiana.
Oh.
Yeah,
There's the statement.
Thank you.
any more from animal programs?
Nope, I think that's it.
Okay. Dr. Sir.
Thank you very much. Today I wanted to go over some highlights from last quarter for the Meat and Poultry Inspection Division. Last quarter was, there were a lot of audits. We did very well, I'm happy to report. The civil rights audit in April was completely virtual this year for the first time. It consisted of phone interviews to many of our inspected facilities and a virtual interview with Dr. Swikowski and myself. The interviews went very well, and we received notice already that our program has equal to status. So that's very good. Our on-site audit with the audit branch of FSIS occurs every 3 years. And this year we had one auditor visit 7 inspected facilities throughout our state, 1 custom exempt, 1 compliance ride-along, and the central office visit all in 2 weeks. And this audit went very well also. We had our exit meeting where only a few minor findings were found. And we'll be wrapping everything up within the next 30 days to close out the entire audit. Equal two status will not be a problem for our program, and we'll receive notice after the audit follow-up is completed. However, the auditor did say she did not foresee any problems. Everything went very well, and she was very impressed that all of our inspectors that she spoke with knew their jobs well, and she was very pleased with our state. We did have one new plant this year, or this quarter, join the program for poultry slaughter and processing. So we now have 3 throughout the state that do exclusively poultry slaughter and processing under inspection. This plant is in Bern, I don't know how you pronounce that, but it's south of Fort Wayne. We also have, we have these 3 that are inspected poultry and slaughter exclusively. We also have 3 limited permits, which are exempt poultry, so they're not inspected. We currently have 27 CIS plants. This is the Cooperative Interstate Shipment Program, which is the joint venture between USDA and state inspection. And we are expected to have 2 more plants join in the next couple of months. We do have a long list of plants interested in the program, and our auditors are currently out starting, now that the audits are over, starting back in on food safety assessments so we can get these plants ready and hopefully have more joining the program. Dr. Swikowski and I attended the Association of Meat Inspection Directors Conference in April, and Dr. Swikowski was voted as treasurer for the national group, which is wonderful. We had a few less surveillance visits from our compliance department. We have 1 compliance officer now who also is one of our auditors. So we had 1 compliance officer retire. So now Jamie Noble is our sole compliance officer. But he did 14 surveillance visits, investigated 3 cases of illegally branded meat products, and he completed 1 investigation that resulted from the audit, and that ended up being a joint investigation with the USDA as the product crossed state lines and was found over in Illinois as well. We did have a booth at the Boilermaker Vet Camp this summer. It occurred during the audit, however, so Dr. Swikowski and myself were not able to attend, but we were, luckily, we were represented by Dr. Strasser, one of the area veterinarians, and Matt Seedling, who is an animal health specialist, who used to be an inspector for the Meat and Poultry Inspection Division. So they were able to provide organs for carcasses that the vet students could touch with gloved hands. And they even brought in a goat skull this year. So the children got to see a goat skull as well, which was a big hit, I understand. As far as facilities, we have 87 official establishments, 3 limited permit retail HRIs, that's the limited permit for the exempt poultry. And then we have 52 custom exempt establishments, leading to a total of 142 program facilities. We currently have 2 open inspector positions, 1 in the Northeast area and 1 in the West Central area. And I'm hoping to have a compliance position opening soon. We continue to take advantage of our USDA FSIS virtual training courses. We had 3 employees complete the EIO condensed course in May, which is a course to learn about the auditing procedures, but they don't receive official, not an official status to be able to conduct the audits. But we are looking ahead. We are hoping to finish up the on-site audit within the next 30 days. And Dr. Swikowski will be meeting weekly with small groups for training. We'll continue our extensive training program. We're expecting about 2 facilities to join the MPI program in the next few months. So this number has decreased. However, we have a long list of facilities wanting to join the CIS program. Dr. Swikowski and myself are planning to attend the meat inspection directors meeting in Denver in October. And our EIOs, our auditors, will continue their training of all inspectors quarterly. We continue our outreach with other agencies, and we have weekly teleconference meetings with our field staff. Anybody have any questions?
I want to comment. I take time, to do these sometimes. We just returned from the Junior National Hereford Show. And during this show, there's not just showing, there's other competitions. And from each state, there's a team, a senior member, a junior member, and a peewee member who groom an animal and then present it for show. Each state is represented by one team again, and then they're judged. So back to Matt Seedling is where I'm going. Matt Seedling's son and my granddaughter, Matt Seedling's son was the oldest, my granddaughter was the youngest, are reserve national champions. So you compliment Matt when you see him. I told him I was going to bring it up. Make sure and compliment Matt. They did a wonderful job.
Great, thank you.
Doc, I'm going to put you on the spot real quick.
Yeah.
Earlier in the meeting, the board approved a rule change dealing with pet food coming from plants.
Yes.
Could you talk to us a little bit about what you're seeing in the plants and how that rule change will help you with your staffing? Real briefly.
Yes, thank you. Before the rule change, all inspected product had to be sent for use in pet food. There is in the regulations for custom exempt product, which is product that goes back to the owner or owners marked not for sale. In that rule, it said that the product either had to go directly back to the owner or owners, or it had to be denatured and discarded. And so here in Indiana, we are not really changing it entirely, but we are allowing plants to use products from custom exempt carcasses that the owners are not wanting back. So we are asking that each plant gets an approval from the owner as to what parts they don't need or permission to use the material. Also, we're handing out, I guess, approved denaturants that can be used on the product that can be, further used for pet food. So it's safe to use for pet food. So the products do have to be denatured still. They have to be kept separate in a marked, food safe lug. And then, it has to be easily identified and separated from other products as pet food. So this product can be sold to other plants for further use in pet food. Can be used in that plant, just at a different time and space for pet food. But this really frees up our inspectors because we are inspecting a lot of animals right now or we have been for pet food, and that's the only purpose that it was being inspected. But now, if custom exempt products can be used in pet food, that frees up some of our inspectors to inspect only, human food.
So I got one more question for you. So at what point in that process does meat and poultry no longer have charge of those products?
You mean
For going to like dog food, for example?
Well, after it leaves the plant, basically, because pet food is under the jurisdiction of the state chemist's office. So if it leaves the plant, it's no longer under our jurisdiction, or if it's further processed into pet food, after, at that point, when it goes for production of the pet food, it's no longer under our jurisdiction.
I think within the plant, at any time that an inspector thought that it was a problem for human food safety, if they thought it was being commingled or anything like that, they would still have authority to do something with it.
Now, again, is this strictly for parts of animals from custom exempt clients, or is this also animals that the establishment may have purchased with the specific intent of using for pet food?
I'm not sure I understand the question.
Okay, the rule we approved, is this looking at strictly products from custom exempt animals or also animals that the plant purchased with the specific intent to turn into pet food?
Oh, okay. Oh, I see what you're saying. I believe it could be, correct me if I'm wrong,
I mean, I
but
think the rule covers production of pet food within the plant.
That was my understanding of what I read, but I wanted to make sure.
Now, I don't know that we have any plants that are buying the entire animal just for pet food. It's more of the parts for treats and
Okay,
that sort of
sure, okay,
yes. That answers it.
yes.
Okay.
Thank you, Dr.
Thank
Sir.
you.
Okay, since Patrick isn't here, Kyle, you're going to be.
You're stuck with me. Yeah, so the, Patrick's on vacation this week, and Nathan, the deputy of the Dairy Division, got double booked with the FDA, so he's out doing surveys today. So I bet he would rather be here, but here we are. So the report was provided. We're seeing the maintenance of that grade A farms, that number, that 661, for several years that had been declining pretty rapidly. We are seeing that to stabilize to some extent. We've also just kind of had conversations with several dairies that look to be expanding, either new dairies or expanding the dairies that are in place and increasing the number of cows that are being milked. So we are encouraged by that. A lot of the focus for the Dairy Division has been assisting with the Animal Programs Division on the National Milk Testing Strategy. We wanted to make sure we were working very closely with the Dairy Division so that the plan that was put in place was reasonable. So we worked with we've had feedback from our processing plants that the tanker approach to sampling is a reasonable approach. What we found out is as soon as the milk goes into the silo, unscrambling the paperwork of farm of origin based off a silo is incredibly challenging, but they do have it tied very nicely to the tanker level. So we wanted to make sure that we were kind of taking our surveillance strategy and matching that to industry practices as best as possible, and still get the surveillance levels necessary to maintain this. One of the kind of, I wouldn't say concerns, but outstanding questions we have is there's no real endpoint to the National Milk Testing Strategy. The concern that we've had as of late, and Dr. Cooper alluded to this in her report in Arizona, there was likely some, when the detection in poultry out in Arizona had origins of some sort to a dairy and to the dairies that were positive in Arizona. So we're still seeing some movement. It could be a biosecurity issue, animals, people, from dairy to poultry. And until that slows down, I think both industries are going to be on high alert, and we should anticipate a surveillance strategy continuing. But we've not been given an end date for that National Milk Testing Strategy. So we're looking to be as minimally burdensome as possible and sustainable in going forward. So right now we're at 2 days a month in which the plants are just collecting a duplicate sample that they're already taking one sample for antibiotic residue testing, and they're simply grabbing another one. Our folks have the privilege of deciphering some of the handwriting at these plants and figuring out where the farms of origin are on their bills of lading. We are also running antibody testing on all of these as well. That has been a request from USDA to the NALM lab, so we can see what our cows have seen. And if they've seen the virus, we would anticipate having some of those antibodies to be positive. So that would not be unprecedented, but we continue to hope that those the PCR of the virus themselves is not. So some encouraging news that I believe the last introduction into a new state on the livestock side, on the dairy side, was December of last year. So we have had continued detections of the virus, but it's in states where it's already been established. this kind of goes with that notion of once it gets into a community, it runs through that community pretty rapidly. But it, for some reason, hasn't been migrating from state to state for whatever reason. It's not like the cows haven't stopped moving. So we're not sure why that's the case. California is starting to see re-breaks or reintroductions back into their dairies. So they have about 80% of California's dairy herd was impacted by influenza. So they are seeing some reintroductions where it might be a similar virus, it might be the same virus, but they've had enough time, about 6 months or so, in which there is a subpopulation of that herd, especially in these larger dairies, that likely haven't seen the virus before and can be impacted. But they are doing, I believe their state vet said, I believe it was weekly or every other week testing of their dairies to monitor where it's at throughout their state, which I don't know how that's sustainable. But I know their state vet was quoted recently, I believe she was testifying in front of Congress or one of the subcommittees, just the need for a vaccine in the dairy cattle side, right? So that's definitely a push from California. They've got a lot of animals impacted by it. They don't want to continue. And furthermore, we don't know how to declare them free or, what's the actual risk? Risk to poultry, risk to other dairy farms. How do we classify that? Because there's still so much we don't know about this virus when it presents in dairy cattle. I wish we did, but it makes us scratch our heads a lot. So, but the dairy division has been working very closely on that to make sure that we are kind of right sizing our approach and getting us to a point in which we are still looking out for, what's best for the dairy industry, but also make sure we're protecting and safeguarding our poultry as well, since we have a fair amount of both. So any dairy questions?
I've got something to add just real quick. Dr. Shipman mentioned that Nathan's with the FDA. The FDA reviews the program in a number of different ways frequently. But every 3 years they do an in-depth evaluation, and I realize this didn't make the report. And so we got the results of that in-depth evaluation, and I'll just read from the report, this paragraph. This evaluation report is an acknowledgement that the Indiana State Board of Animal Health Dairy Program is a model NCIMS participant that reflects the principles and the essence of the cooperative nature of the NCIMS. This is largely due to the commitment of the State Board of Animal Health and the dedication of your agency and staff towards the success of their public health mission. So that's a good report. So I don't know why Patrick did not include that in his report. I guess he's being modest. Congratulations to the division.
Yeah, for sure.
There you go, interns. We're models. Okay.
I am working with the dairy division as well as the meat and poultry inspection and animal programs to get out onto some of these inspections, just to lay eyes on that, lay eyes on the process. I haven't seen nearly, I've been on several tours, but I want to see the inspection process as our inspectors do. So I have been on a few and working on to get several others scheduled. So you may hear me around the state. That's likely what I'm doing, is trying to get into some of these plants and just lay eyes on what our inspectors are laying eyes on. Some of the stainless, they call it stainless spaghetti in these dairy processing facilities, and it's remarkable how I still don't know how they inspect it. And I was there for a solid day. Yeah, it was remarkable. So, but yeah, I'm working my way around to try to lay eyes on several different operations across the state and better understand what that looks like.
Okay. You get to continue.
Sure, absolutely. So a lot of what's in my report has been covered by those in this room. A lot of work continues to move forward. We're working to get back to what our normal is, whatever that may be. I appreciate the thanks given to Gary and Sarah as far as trying to keep up with some of the administration's new executive orders, because that, I mean, someone made the comment, if you haven't checked in on your general counsel lately, you might want to go check in on them because they're getting, it's a lot of work getting put in place to make sure that we are meeting and exceeding those executive orders. So I definitely appreciate that and the work that's getting done. Just to get that. And the timelines are pretty short, and I think that's the challenge is I don't know that they've always been this short. They usually give you a little bit more time, what I'm told, to get that done. And the shorter timelines makes it very difficult to kind of iron out. Something that's encouraging that we're excited to see, and this is only due to the collaboration that and the forces that we're able to unite under the Center for Animal Policy, is we're starting to begin the process of rulemaking for the Board of Veterinary Medicine. So the Board of Veterinary Medicine hasn't done rulemaking in a decades maybe, and needs some TLC, right? So with Brittany, they're directing that board. They are beginning that process, a comprehensive process of rulemaking for the Practice Act, the continuing education, fees, fines, penalties, stuff that generally happens here pretty routinely. It just hasn't happened there because under PLA, the infrastructure wasn't there to get that moving. So the first one is to make sure we're compliant with the fees, fines, and civil penalties, as well as looking at continuing education requirements. So veterinarians, stay tuned. The board is reviewing that and hoping to update that to a more simplistic, modern approach, so that it's straightforward. We get a ton of questions about what counts, what doesn't count, what's self-study, what's online, what's this, all of that. And it's really confusing, and we can sometimes talk ourselves into a corner just reading it ourselves. So they are actively looking to update that, trying to potentially do some extending some CE opportunities to those that are authoring peer-reviewed papers or publishing in textbooks as additional CE opportunities there as well as waiving or counting the CE for those that are in an internship or a residency program, as well as for those that present routinely. They'd be able to earn CE for actually putting their presentation together, because it does take significant amount of work to put the presentation together to deliver the CE content. So taking a look at that. So they are working to get that. They are also having a special meeting in November to further discuss what other parts of the rulemaking process they want to dive into. So they've really taken a head-on approach, and we appreciate that. I know Brittany is, it's keeping Brittany on her toes of what those next steps look like. Some of the stuff that they're looking to even repeal is some of the application process. So the Board of Veterinary Medicine no longer administers an exam as they previously have. And so we leverage the national exams for licensing. So just repealing stuff that's out of date or that no longer applies. We were successful in this last legislative session to update the language to allow background checks to pass through the state police, from FBI through state police over to the Board of Veterinary Medicine, so that we can review those. That's not in place functionally yet, but the language has been updated so that once we get some responses out of FBI, we are able to do that. So again, looking to streamline those, match that with the KPIs that Gary talked about in his report, and really make sure that we are delivering those constituent services in a timely manner. That's a big, big focus of the governor. So the governor up through this summer, like I had mentioned previously, is meeting with agency heads, all agency heads every other week. So pretty routinely there. And then within our vertical with our secretary, Jaworski, is meeting monthly with the agency heads in the vertical. So a big focus for all of that is, supporting entrepreneurs and making sure that our constituents' services are delivered in a timely manner. So fortunately, I think we're well positioned to deliver on both of those through all of our programs. It's just making sure we are appropriately telling our story and capturing it in a way that does so. So with that, are there any questions of me?
Is there any consideration of lowering the number of hours that we have to get every 2 years?
It can be a consideration.
Provide comments.
Yeah. The main one being is, there's been chatter about online versus not self-study, and what they're moving towards is 40 hours is 40 hours is 40 hours. Get them how you get them. And don't, the rest is,
I think that would be great.
so.
Any other questions? Okay. Before we establish a date and do a couple things, Julia, you had something you wanted to mention.
Yes, thank you. Julia Wickard, College of Veterinary Medicine. So great to see many of you. And thank you for everything that the Board of Animal Health does. I would echo my career to those folks over there. You're amazing people, and I just feel very blessed to be able to work with you. And thank you to the board for your leadership and everything you do on farms and in clinics and with the food animal industry in our state. So one thing just wanted to mention, and really it's a message from Dr. Thacker, Leon Thacker, many of you know him, but he is putting together a group to assist with the state fair in the Pioneer Village. He's looking for 4 veterinarians a day, 2 for a shift, to work in the Pioneer Village vet medicine office. So if you want a fun day at the fair and you're interested, if you want to see me, I can send you the link, or I can get it to Dr. Shipman, he can send it out. But I just wanted to mention that he's just looking for veterinarians, vet technicians, anyone from the industry to help staff that at the state fair. Thank you.
Okay. We need to establish the date for the October meeting. October 7 is the proposed date. Questions, concerns? Yeses, nos? Yeah, who cares? Well, if there's no concerns, we will propose that, or we'll use that proposed date, October 7th. Same time, same place. Do the same thing. And as usual, before we quit, you people sitting around here, thank you. You're good. We appreciate it. You don't know how we appreciate what you do. And I'll put you up against anybody. I'll fight tooth and nails for you. You do a great job. Lunch is supposed to be here.
It's here, she's finishing setting up, so it should be just
Okay.
be in nature break, be a good time for it.
Okay,
Maggiano's.
so Maggiano's is providing today good food for everyone.
Thanks for corn and soybean.
Yes, thanks you, corn and soybean board. Any comments? Make sure and sign your papers. With that, we're just going to adjourn the meeting. Thank you all.